Thank you all for joining us here this afternoon. Can I start by thanking everyone who went out and got tested yesterday? Over 9,000 West Australians received a PCR test. And can I thank all our staff working at the PCR clinics in some serious heat. This morning, a meeting of the State Disaster Council was held to consider the latest health advice and the review of the state's border controls as flagged last month. A number of decisions were taken, so there is a lot to cover, so please bear with us as we walk through the important next steps for Western Australia. You would have seen that WA recorded an additional 202 COVID cases of COVID-19 to 8 p.m. last night. The number of local cases out of that group is 194. 8 were travellers. Our total number of active cases is 724. There is good news, and that is our hospitalisations from COVID remain at 0 for the time being. The case numbers that have been recorded in the past 3 days are significant. It is a noticeable step up. And given what we now know about Omicron and how highly infectious the strain is, Western Australians will see a continued growth in case numbers in the days ahead. This is not a surprise. This is something we've been expecting for some time. It's a reminder that this pandemic should be taken seriously. 4 weeks ago, on January 20, we took the difficult decision to delay Western Australia's full border reopening. It was a tough call, one that caused inconvenience and disruption to those who had made plans around that date. As I said on the night, I'm sorry that we had to do that, but it was the right call for our state. It was a decision that saved scores, if not hundreds of lives. If we'd completely abandoned our border controls at the height of the East Coast pandemic, with low third dose vaccination rates and low vaccination rates amongst children, it would have seeded many hundreds or thousands of cases into the community at once. It would have caused massive economic dislocation, and it would have had the consequence that many people would have died. Proceeding with the original plan on February 5 would have been a complete unforced error. We would have deliberately infected our state with a highly transmissible variant, whilst third dose rates were low. Instead, we created a safe pathway for tens of thousands of Western Australians and others to come back in a safe and orderly way with quarantine and testing. An opportunity taken up by more than 34,000 people so far. And we committed to review the border controls in February while we drove up our vaccination rates. That review has now been completed, and it is clear that the situation has improved. Thankfully, the East Coast Omicron outbreak appears to have peaked and is declining. On January 20, when we made the decision to delay the full removal of our hard border, Australia recorded over 75,000 cases that day. Today, that number was just over a third of that, at around 25,800. On January 20, over 5,000 people were in hospital with COVID around the country. Today, there were around half that, with just over 2,500. We have driven up our vaccination rates, with our third dose rates soaring from 25% then to more than 55% today and climbing rapidly. That's more than double. And for those aged 70 or above, the rate is now over 80%. On top of that, first doses for children aged 5 to 11 have tripled from 13% to 45.7%. That's an extra 70,000 Western Australian children who've had the opportunity to get protected. Protected from what we have seen in the eastern states. These numbers are precisely the reason we made the difficult decision to delay removing the hard border. As we all know, children barely had a chance to be vaccinated prior to the original date. And third doses are vital in the fight against Omicron, reducing the chance of serious illness, hospitalisation and death. We also have an outbreak in WA that we can't stop, and its numbers continue to climb. Eventually, there comes a point where the border is ineffective when you get to high case numbers within the state. It is plain to see that 4 weeks of caution has paid dividends. It means it is now far safer to relax our hard border settings. So based on the latest health advice, I can announce that effective 12:01 a.m, Thursday the 3rd of March, Western Australia will resume our full border opening, safely, sensibly and responsibly. In 12 days' time, for interstate arrivals, it will mean quarantine-free travel can resume for triple-dose vaccinated people aged 12 and older if eligible. Travellers will need to declare their vaccination through the G2G pass system and will be required to take a rapid antigen test, provided to them at the airport within 12 hours and report any positive result to WA Health. International arrivals will need to have a registered G2G pass and meet the Commonwealth Government requirements to enter Australia. This means being fully vaccinated under the Commonwealth requirements if eligible, and take a rapid antigen test within 12 hours and report any positive result to WA Health. Unvaccinated returning Australians from overseas will be required to complete 7 days of hotel quarantine. I've written to the Prime Minister to indicate that the number of unvaccinated international arrivals will be limited to 70 per week. I know removing the hard border is a step that some in the community have been looking forward to. The notice period of nearly 2 weeks gives the community and businesses time to prepare and make plans. I note there are also Western Australians who will be apprehensive, but I want them to know, based on current projections, by March 3, we expect WA will have a 3rd dose of 70%, an incredible vaccination rate. Our 1st and 2nd dose rates will be at nearly 100%, and a 1st dose rate for children aged 5 to 11 of 65%. This puts our state in the strongest position, unlike anywhere else in the world. In any event, the virus is already here, and we cannot stop its spread. So please, if it's been 3 months since your 2nd dose, go and book your 3rd dose now. Do not wait, do not hesitate. Vaccination can save your life. March 3 will be a step forward for Western Australia. A safe step forward, taken at the right time, in the right way, for the right reasons. The introduction of quarantine-free travel will naturally mean there will be spread of the virus in WA. At the same time, it is evident that our daily case numbers are accelerating. This Omicron outbreak effectively started in WA on January 2, when a traveller from Tasmania arrived with Omicron. More than 6 weeks later, only now are we seeing daily local case numbers in the triple digits. This is a long time to hold an Omicron outbreak at bay, thanks to so many Western Australians willing to do the right thing. Unfortunately now, the current size and pace of the outbreak will continue to accelerate. And in order to avoid the worst outcomes that we have seen in the eastern states, we will need to introduce some additional public health measures. We've seen from the experience of the other states that an appropriate level of public health measures introduced early drastically reduces the surge in case numbers, the overall disruption to the economy, and hospitalisations and deaths. We've seen that waiting too long can have dire consequences, deadly consequences. The measures are about trying to strike the right balance to minimise the impact on businesses and the economy and jobs, and to save lives. Firstly, effective 6 a.m, Monday, February 21, the indoor mask requirements will be extended statewide. This means masks will need to be worn in all indoor public spaces in the Kimberley, Midwest, Gascoyne and Goldfields, as well as the existing parts of the state. Omicron is fast moving. If it's not already in a specific region, we can assume it will be there soon. Secondly, in order to manage the spread of the virus, we will be introducing what we are calling level 1 measures in regions where there is currently community transmission. So for Perth, Peel and the Southwest, Great Southern, Wheatbelt and Pilbara, from 6 a.m. Monday, 21 February, the following level 1 measures will come into effect. The 2 square metre rule will return for all hospitality and entertainment venues, things like bars, restaurants, cafes and the like. Cultural venues, fitness venues, hairdressers, beauty services and places of worship. The 2 square metre rule is the main principle, with specific settings for the following venues. Forward-facing seated entertainment venues like theatres and cinemas can have a 75% capacity, as can major stadiums. Nightclubs will have the 2 square metre rule, but crowds are capped at 500 patrons. And the Crown Casino Complex, in addition to the 2 square metre rule, will have seated service requirements on the gaming floor. While this will be disappointing to some operators, these measures allow major events, live music and hospitality venues to keep operating safely. It's important to note that standing consumption is still allowed and dancing is still allowed. Like I said, we're trying to strike a safe balance. In addition, home gatherings will be limited to 30 people. Private outdoor events not at the home will be capped at 200 people. Hospitals, disability care and aged care will have limits on visitation, 4 visitors a day, with masks and vaccination mandatory. However, there will be exemptions for compassionate reasons. We will not be requiring people to work from home. However, businesses and office environments should take appropriate steps to ensure their workplaces are COVID safe. It's worth reiterating, these level 1 measures are for Perth, Peel, the Southwest, Great Southern, Wheatbelt and Pilbara. The rest of the state will just have the indoor mask requirement and existing proof of vaccination and contact registration requirements. We are taking these steps now to avoid further pain later. Reasonable, sensible public health measures today to keep more businesses open. Give the public more confidence they can safely go about their business, while at the same time manage the rise in infection and reduce the impact on the health system and our hard-working doctors and nurses. Level 2 measures will be enacted further down the road if necessary. These would include the 4 square metre rule indoors, mask wearing measures for year 3s and above, working from home for vulnerable people, and home gatherings reduced to a total of 10 people. More details about Level 1 and Level 2 will be available on the website at wa.gov.au. I can also announce that with WA achieving more than 95% double dose vaccination, and based on the latest health advice, bottle shops will be removed from proof of vaccination requirements immediately. This is being done ahead of a review of other proof of vaccination and contact registration measures, given that we're entering the next phase of the pandemic. With regards to public health measures, we can see the difference between New South Wales, which removed all restrictions in mid-December, and South Australia, which has had a stricter level of public health measures in place. Whilst it's hard to get a reliable picture of spread due to testing systems over East being overwhelmed, the cold hard fact is, since January 1, accounting for population differences, South Australia has had 33% fewer COVID deaths than New South Wales. With the virus in the community, we know these kinds of measures will save lives. So while these public health measures are not something I want to do, we know from the eastern states' experience that applying measures before the peak will help in the long run. However, we do know that with the combination of rising infections and our moderate public health measures, people's behaviour changes. People choose to stay home sometimes. They avoid venues and retail. Confidence falls. They save for a rainy day. So where possible, I ask Western Australians to support local businesses, to back them through the next phase, whether it be a coffee in the morning, a dinner from your local favourite restaurant, or through tickets to a show or the movies. We know that putting the health of the public first is always the better economic response. That being said, given our strong financial management, We will be in a position to support affected local businesses in the future, and we'll have more to say about this in the days ahead. As I said before, this is a step forward for Western Australia, the right step forward at the right time. And we can do it because West Australians banded together and did the right thing by getting vaccinated. We postponed our full border opening to drive up our vaccination rates and avoid the peak of the East Coast Omicron outbreak. The national peak appears to have passed. 70,000 West Australian children aged 5 to 11 have been able to receive their first dose. And we're on track to have a 70% third dose rate by March 3. We promised to provide an expanded, compassionate pathway so more Western Australians could come home safely. And that is what we did. 34,000 West Australians have used that pathway, safely sparing WA from a massive seeding event. We committed to review the border situation in February, and now that review is over, we've set a new date. A date that is safe, sensible and responsible. We are putting in a reasonable set of measures to manage the spread of the virus, which enables people to feel confident to go about their business. We are moving forward and doing so in a way that saves lives, jobs and the economy. This pandemic has been going on for 2 years. People are tired. People want to move forward. People want certainty. I feel the same way. But unfortunately, there is nothing perfect in a pandemic. I wish I could tell you life is going to get easier after March 3, but I can't. It's going to be bumpy. We can't ignore that. We can't become numb to the threat that we face and the impact in terms of loss of life. Saving West Australian lives is important, no matter your age or your existing medical condition. I firmly believe that saving WA lives has been worth every effort over the past 2 years. But what gives me confidence, what should give everyone confidence, is that despite the fatigue and frustration, whenever we have asked Western Australians to do something to protect themselves and the people around them, they have risen to the occasion. Western Australians rallied together. WA is now one of the most highly vaccinated places on the planet, with an incredibly high third dose vaccination rate. We have the right systems in place now to deal with the fastest spreading Omicron, with the right close contact rules, public health measures and rapid antigen test supplies. Our hospitals are ready. Our workforces are ready. Western Australia is ready. And when called upon, West Australians have always and will always do the right thing for each other. It makes me proud to be a West Australian. I'll now hand over to the Health Minister and then return for any questions.
Good afternoon, everyone, and thank you, Premier. The decisions we are announcing today, based on the health advice, are underpinned by a number of factors. These include our impressive vaccination rates, our preparedness measures, and updated Omicron modelling carried out by WA Health. Now that WA Health has been able to provide us with updated epidemiological data which provides useful insights, as a guide, I want to take you through it. Importantly, the updated modelling shows that our third dose vaccination rate will continue to increase. It is expected we will reach 70% third dose by the time the border opens and attain 80% later in March. This is great news and is testament to the incredible work of our vaccine commanders, both past and present, our health staff and every West Australian who has heeded the call to roll up for WA, and I thank you all for this. We know that a third dose provides much better protection from Omicron, and I'm pleased that we have been able to give more West Australians time to properly arm themselves against this variant. The Omicron modelling confirms that we will reach peak immunity in March 2022. This means our community will have the optimal protection from COVID-19 when we transition our controlled borders and see daily case numbers above 1,000. In terms of case numbers, we know that the third dose prevents severe illness and that the Omicron strain, for most people, isn't as deadly as the previous strains if they are vaccinated. This means most West Australians who contract COVID will be able to manage their illness at home, whether with the assistance of a GP or through the WA COVID at Home program. But Omicron is highly transmissible and we will see cases continue to grow. The modelling suggests we will reach a caseload peak at the end of March of around 10,000 daily cases. In New South Wales, at the peak, they recorded more than 250,000 cases a week. In addition, the modelling predicts we could have around 443 general hospital beds occupied at peak with COVID, with around another 53 in ICU. I know this news will be confronting for many, as our successful management of the virus kept COVID out of our state for so long, and we are not used to seeing high numbers of cases here. But I am confident that as a community, we are well protected and well prepared. I have no doubt that were it not for our high vaccination rates and our public health measures, this peak daily case figure and hospitalisations would be much, much higher. Sadly, the modelling also tells us that we can expect 4 lives to be lost each day once we reach the peak. Any life loss is hard to take. But we know that our cautious and safe approach has meant that more people than ever are protected against Omicron by their 3rd dose of the vaccination, and this means we are in the best position to avoid the worst of Omicron, which we have seen other states experience in the last 2 months. So I want to thank you all for getting vaccinated and continuing to follow the health directions. You are doing your bit to protect yourself and the vulnerable people in our community and to ease the burden on our frontline staff. We will get through this as we have done for the past 2 years together. Our hospitals and our hard-working health staff are well prepared to meet the challenges of the next few months. We've invested a record $3.2 billion in our health and mental health system. We are adding an extra 530 beds to the system, with 300 already open, and we are actively recruiting health staff across the state to Perth and the regions. And we have developed and launched a home monitoring program. To minimise transmission of COVID within our emergency departments, marquees have been set up to allow for safe testing and triage. Anyone with symptoms who present to our emergency departments in Perth, South West, Wheatbelt and Great Southern, and soon the Pilbara, will be given a RAT test to screen for COVID. We have announced that elective surgery bookings will be paused for about 8 weeks to ensure hospitals can manage through the peak. Outpatient services are being moved to telehealth where possible. We have 10 million RAT tests in stock and more arriving every day. Our health system is as ready as it can be. Our careful, cautious, conservative approach to the management of this virus has led us to today. Everyone in WA aged 5 and over should get vaccinated, including their 3rd dose, as soon as they are eligible. Vaccination clinics are available at our state-run clinics and at GP clinics and pharmacies. We will also be further expanding our vaccination capacity, bringing online additional clinics, and we'll have more to say about this soon. From the 21st of February, another vaccine, Novavax, will be available at some state vaccination clinics. This vaccine will be available at Kwinana, Perth Convention Centre and Mirrabooka vaccination clinics for people over the age of 18. However, it is not currently recommended by ATAGI for use as a 3rd dose. Novavax will be available in the Goldfields, Kimberley and Pilbara regions from February 28. Bookings are essential and can be made via the Vaccinate WA website, and I'd urge people to continue to check the exposure sites regularly and present yourself for testing if you're feeling unwell. Continue to use Service WA, wear a mask at indoor venues and outside if you can't social distance. It is the responsibility of all of us to protect those most vulnerable in our community. And as I've said before, you might not become seriously unwell from this virus, but others, including someone you love, could. WA has worked hard to minimise the spread of the virus, and as a state, we are ready for this next phase in the pandemic. I urge West Australians to continue to do the right thing. Get tested immediately if you're experiencing any COVID-19 symptoms. I'll hand now back to the Premier for questions.
Right, thanks, Minister. Any questions?
Premier, how can the public trust this date is locked in?
This date is locked in, and I can't foresee a situation where it would change. It's only 12 days away, so it's very, it's a lot closer than last time, and I'll take you through last time just so it's very clear for everyone what happened. Back in December, well, I think it was December 13, when we announced the February 5 date. What was that, 7 weeks time frame between the two? We didn't know about the Omicron outbreak. We didn't know about the strength of it, I'll put it that way, and we didn't know what it'd do. So obviously when I announced it in December 13, I said that it was subject to there not being a catastrophe or an emergency. I was very clear about that. Obviously, the Omicron outbreak in the eastern states was a catastrophe and an emergency, so therefore we had to change the date. We changed the date, and the extra month has given us the capacity to get hundreds and hundreds of thousands of West Australians their third dose, to get many thousands of children their third dose, and to avoid the peak in the eastern states. So we weren't opening the border at the peak of the spread in the eastern states, which would have been catastrophic. So by doing what we've done and delaying by a month, we've saved scores, if not hundreds of lives, West Australian lives. We've also saved a great many jobs, because as you can see, what happens in the east, where they had low vaccination levels and the spread of Omicron, it was pretty economically catastrophic. So we've done everything we can to ameliorate the impact. We've done everything we can to protect West Australians. Unfortunately now, the virus is already here. It got through in early January. It's spreading relatively quickly now. We can't stop it. So we've done everything we can to provide the best environment for when it gets here, so we keep West Australians safe. We protect jobs as best we can. We protect our hospitals, and we have the softest landing possible in a COVID environment out of all of this.
What is it that will determine the ending of those restrictions in terms of 2 square metre? What are you looking at to bring those off? Obviously the hospitality sector will be very keen to know how long it's going to last.
I don't have an answer on how long it'll last, but I expect it'll be in place for a considerable period. And the advice we have is that states that bring them off too quickly inevitably have, or often have, an upturn in cases and often have to reinstate them. So what you've seen in New South Wales is them have restrictions, pull them off, reinstate them, pull them off. So you just got to be very careful about that. But the level 1 restrictions we've announced today are relatively mild. The level 2 restrictions are much harsher. And we haven't made a decision in relation to those at this point in time.
Do you have a sentiment of how long, what you need to go to level 2 and what sort of case numbers you
Well, we have to watch. You see, Western Australia is an experiment. We basically have had very few Omicron cases. We have very high vaccination levels, and we have a very compliant population. I don't think there's anywhere else in the world that is going to have a major outbreak, as is coming, with those factors in play. So we have to watch and see how it goes and what our hospitalisation rates are in practice. So all those things will be considered, but we're putting in place restrictions as of Monday. I know some people won't like that, but if you have a look at what's occurred in other parts of the world and other parts of Australia, you have to do that in order to make sure the peak in infection is not so high and not so difficult that it becomes very debilitating for our community.
So you're starting to look at more hospitalisations and ICU hospitalisations as well. Is that what the government's kind of more looking towards now, rather than?
Oh well, they're important. With high vaccination levels, they're the most important consideration, I think.
Could you clarify if masks will need to be worn at gyms while people are exercising?
I think it's the existing rule, which is if you're doing vigorous exercise, you don't have to wear a mask. But that's the rule that's currently in place. But the mask wearing mandate is extending all over the state. So the Kimberley, the other parts of the state that don't currently have the mask wearing mandate, that mandate starts as of Monday morning.
Premier, the Omicron modelling that says we'll get to a peak of around 10,000 cases, does that include the probability that we'll move to level 2 restrictions, or is that based on level 1?
It does include the probability of level 2 restrictions.
430 case hospitalisations at the peak, was that?
That's it. So I think the Minister outlined it. We're expecting the peak will be at the end of March. It'll be around 10,000 cases per day. 443 general ward beds will be occupied, 53 ICU beds, and sadly 4 people per day would pass away.
430 hospitalisations at the peak is what Professor Milne forecast. You were pretty dismissive of him as a mathematician, but that's what your modelling is showing.
I don't think that's a correct characterisation of what I said. But in any event, we've had to delay in order to save lives. That's what we've done. And I mean, I know I've copped enormous amounts of criticism over that. But we did it for the right reasons. We did what we had to do in a very difficult set of circumstances. And if I had my time again, I'd do exactly the same thing again.
Does this cut your quarantine in half when returning from the Palmer court case?
No, it doesn't. Look, it is a coincidence that when I return, the border will come down a couple of days later. That's a coincidence I haven't been able to avoid. If I can finish what I'm saying, it's a coincidence I am unable to avoid. That I return from Sydney. I'm in quarantine when the border comes down, but I'll be doing 7 days of quarantine. So I'll be in a hotel room, working from a hotel room, doing a full 7 days, and just so there can be no argument that somehow, by anyone, that somehow this was put in place to benefit myself.
With John Quigley, will you do your quarantine?
I'm sorry?
So you'll double your quarantine to make a point that this wasn't...
No, well, just to be clear, I can't have it said that in some way this was put in place to benefit me. So I'm actually trying to do the right thing here. So I'll do a full 7 days quarantine, and I'll make sure that I stay in quarantine. I'll be in a hotel room, but I'll be working the whole time. And otherwise, you know, people would say all sorts of things, and I don't want that said.
But just to clarify, travellers who maybe come back before March 3 and their 7 days would initially end after that date, they'll be free to leave quarantine at March 3.
That's right. So any other traveller will be free to leave. Yep.
That's a pretty bizarre situation.
I didn't create it.
No,
I can't. But I can't. If I can explain, I can't extend the time frame just so that everyone has to stay 7 days quarantine because I have to stay in 7 days quarantine.
But why should
So
you
I.
have to stay for 7 days? I'm on your side here, Premier. Why
Yeah,
should
I
you
know.
have 7 days quarantine with John Quigley?
Yeah, I am trying to do.
Think about that.
I am trying to do the right thing by the state, and I'm just trying to set the right example. And you know, it's a tricky situation, not of my creation. I didn't bring this court case, as you know. Mr. Palmer brought this court case. I didn't bring it. I didn't set the date. The court's holding it. I'm just trying to do the right thing here.
What is the total number of deaths that are expected in this Omicron wave, and what is the evidence that hundreds of lives have been saved by this delay?
Do you have the total number of deaths?
Yeah, I do.
Okay, you just call them out. Just call them out to me, Andy.
It's around 134 to 146.
Okay, 134 to 146. My evidence is what's happened in Queensland, South Australia, which brought down their borders. And so Queensland has had, this year alone, 447 people pass away. South Australia's had 163 people pass away. So they were basically like us, relatively COVID-free, in fact COVID-free. And they brought down their borders and those people died. So by getting a third dose vax rate up, as the Chief Medical Officer of Australia told us, that reduces the severity of the illness. And by reducing the severity of the illness, you save lives.
Do you say to Jetstar reschedule your flights now?
Yeah, well, that they can. Obviously, the airlines. I've been in contact with some of the airlines just before I walked in here. They can start planning for these sorts of matters.
You previously were talking about, I think earlier this month or late January, you were talking about second waves posing a danger to Western Australia. Are you not concerned about that anymore?
Of course I am. And the Chief Medical Officer said they expect a second wave, or I think they term it a fourth wave actually, because you've got to remember the eastern states have had wave after wave after wave, so they're terming it a fourth wave. For us, I don't think it is a fourth wave. I think it's probably a second wave. They're expecting that over the winter months, and that may well be unavoidable. But as I've tried to say, we're getting to very high vaccination levels, third dose. Meantime, we've got an outbreak we can't control. And those two things are going to intersect. They're going to intersect at about March 3, where we get to 70% vaccination, we get to around 1,700 potentially cases per day that are organically generated in Western Australia before such time as we open the border. Now, we haven't opened the border as we were originally planning back in February. But by doing that, we didn't deliberately infect our state. I didn't want to deliberately infect our state whilst third dose vaccination levels were low. I mean, that would have been a shocking thing to have done. And it would have resulted in mass dislocation and people dying and sickness and illness and all sorts of families going through grieving. I didn't want to do that. I mean, and as I keep saying to you all, if I had my time again, I'd do exactly what I did. Because by doing what we did, we saved many families a great deal of grief and many businesses a great deal of trouble and a lot of terrible turmoil within our state. Now, as it stands, we can't stop the current outbreak. So it's there. We've kept it low. I mean, I don't know if there's anywhere else, certainly not in Australia, I don't know anywhere else in the world that's had Omicron come in, 6 weeks ago or 7 weeks ago, 2nd of January it came in, and it's still only at a low number of cases. But it's growing pretty rapidly now, and we're not going to be able to stop it. So there comes a point where the border is redundant because we'll already have the growth of cases here. Having the border is no longer effective. At this point in time, it still is while we get our vaccination levels up, but we estimate by March 3 it won't be of much effect.
Do you stand by the bottle shop decision? Was that the right call, or did you make the wrong call in doing that?
Well, it helped us get our vaccination levels up. So our vaccination levels, our vaccination levels are quite stunning, how high they are. We're nearly 100% first dose. We're at over 95% double dose, and we're at around 55% third dose. So of the mainland Australian states, I think we're now leading. And that's without a major outbreak. So the measures we took, the mandates, the vax certificates and the like, have worked. They've worked. And what that means is we saved a great many lives and a great many jobs. Now, I know some people don't like it, and they're out there camping and protesting and so forth, but I think most people get that because of our unique situation, not having community spread of the virus, not having mass outbreaks, not having all the people that were dying like were occurring in Melbourne and Sydney, we had to take alternative measures to get people vaccinated, and so the measures we used worked.
Attorney General John Quigley has gone from saying he couldn't recall if he was maskless inside a packed church to now saying, I accept I may have inadvertently have not worn a mask while I was inside. How angry are you at him for undermining your government's COVID rules?
I'll just explain what happened. So Mr Quigley went to a funeral of a family member of his that he has known for the last 45 years. Sad event. He had a mask in his pocket, and he was gathering outside the church with other family members and other mourners. At the last moment, someone asked him to be a pallbearer. So he was a pallbearer on the coffin. He forgot to put his mask on, apparently. People told him when he got in the church and he sat down that he didn't have his mask on, so he then put his mask on. So he was advised that he hadn't worn his mask. So that's what's happened. So look, he's made a mistake. He's paid a fine. He's remorseful.
He's
So
paid a fine.
He's paid a fine.
Do you know how much?
$1,000.
And that was issued by Broome Police, I assume?
I'll let the police commissioner. I didn't know about it till just before I came in, but I'll let the police commissioner answer those questions.
Can I ask you about Terry Healy? So he's been identified as a close contact. Do you know when he was identified as a close contact?
I think it was yesterday. I think he's doing a PCR test and isolating as we speak. I don't know a great deal about it, but I saw him at Parliament yesterday. He was wearing a mask. I was wearing a mask. Everyone was wearing masks. So, but he.
Suddenly leave during Parliament. Do you know?
I don't know. I didn't know about it till today.
Just in terms of
But as you know, the Parliament's operating a bit differently at the moment, so that might have been something to do with it.
Are there any other politicians isolating? Any other MPs?
Well, I'm going to shortly, but not as far as I know.
in terms of the proof of vaccine, obviously bottle shops now are taken out of the equation. There's a lot of angst going on there in terms of bottle shop attendants being abused and so on. It goes on in other places, cafes as well. Would you consider removing? I mean, given the amount of people vaccinated, why are we having to do this for such a...
We're going to keep driving the rate up. Bottle shops are a bit of a unique circumstance, but we're going to review all of those measures over coming weeks.
Just back on the Terry Healy situation. He was maskless for about half an hour in the chamber. He gave a reply to your Premier's statement. If he comes back COVID positive today, do you know what the consequence is for everyone who's been dining with him and who was in the chamber with him during that time?
I would seek the advice of the Chief Health Officer, but the close contact rules are there for everyone to see. So they are, both parties need to not be wearing a mask in close proximity to each other in a small room for 15 minutes or in a larger venue for 2 hours from memory. And so if he had his mask off for 30 minutes while he's making a speech, as you're required to, because people need to be able to, like I am now, need to be able to see your mouth move when you speak, so it's clear. So I don't know if there's any further consequence than that, but obviously anyone who is concerned about their proximity to him should go and get tested.
Premier, initially when the February 5 date was in place, increased restrictions were going to be brought in at that time. What was the thought process around bringing level 1 restrictions in earlier than the 40 days?
Because we already have community spread. So we have nearly 200 cases in Western Australia today. And the evidence out of South Australia is if you bring in your public health social measures earlier, then you have a better outcome.
So can I just ask why we don't know when the level 2 restrictions will be brought in? Why we don't have like a case limit or a hospitalisation limit? Well,
as I said earlier, we are unique. Western Australia is unique because we have very low caseloads with very high vaccination and a very understanding and compliant population. And that hasn't occurred anywhere as far as I'm aware. So we can't be too prescriptive at this point in time, but obviously we'll monitor very closely. What sometimes happens we'll watch the hospitalisation rates, but what sometimes happens, and we have to take this into account as well, is sometimes you'll have very little hospitalisation, but it grows very rapidly. So all those factors we'll take into account. But we've announced some public health social measures for Monday, so they kick in at 6 a.m. on Monday morning, and they will be, as I said, pretty mild restrictions. We're going to work up what compensation we need to provide, particularly for some of the retail and other outlets out there, and that's something we're working on as we speak.
Just to clarify, will you still need a G2G pass for interstate travel?
Yes, you will. So G2G pass will remain.
And that could be obviously thousands and thousands. Is that still in the hands of the police to pick off everyone?
That's right. So the police will manage that. The reason we have that is we have a rule for interstate travel that you have to be vaccinated. So the G2G pass is used for those purposes. So that will remain. Our international borders will open on March 3rd as well in accordance with Commonwealth processes, so their rules will remain. The only people who are, we can't control the vaccination status of those people, but we're asking the Prime Minister that they restrict the numbers and would restrict that to 70 people unvaxxed coming in who are Australians internationally, who then have to do a week's quarantine in one of our hotels. So we'll keep some of our hotels operational. And the good thing about our hotel system, which some states have closed down, is it provides us with the opportunity for people who might be positive or might be close contacts for them to go to. So that's why keeping our hotels is a good thing.
The ANF was saying today they were using loose language, but that they may consider striking if their demands aren't met. Has that been taken into account that we might see a whole lot of nurses walk off the job?
I'm sorry, I don't know about it. Maybe the Health Minister will know about it.
The rates in the Pilbara are still lower than the rest of the state, and previously, before the initial border opening, you flagged that you would introduce different kind of restrictions for different regions. Why is that not being considered anymore, and what are you doing to improve rates?
Well, I ruled that out a little while ago. The rates have climbed pretty significantly across the whole state. The Pilbara might still be a little bit behind. We are concerned that the Pilbara figures might not be accurate, just in that there's a lot of FIFO, there's a lot of movement. We don't know if they're actually completely accurate because, and so therefore, all the rules that apply across the rest of the state will apply in the Pilbara, so they will provide a lot of protection from growth in infection, the same as they do across the rest of the state.
So restricted access to some regions is...
No, we're not going to do that. Thank you very much. Did you want the Health Minister?
Just to quickly clarify, unvaccinated Australian arrivals internationally will be capped at 70, but what about general people looking to come into Western Australia who aren't quite here?
Okay,
If
so
you're unvaccinated.
interstate, you have to be vaccinated. We can control that. You have to be vaccinated. And whoever it is, whether you're Australian or international tourist or whatever, and you want to come from Queensland or Victoria to Western Australia, just have to meet the vaccination requirement. And we will issue you with a RAT test on the border or at the airport. So you do a test and you upload your results if you are positive, and then you have to isolate. For international arrivals, the rules that are across Australia, the Commonwealth rules about international tourists will apply here. But I think, and this is the case I think elsewhere in Australia, if you're unvaccinated international tourists, I don't think you can come in. If you're an unvaccinated Australian returning home, you have to do quarantine in one of our hotels. Thank you very much.
Sorry.
No, I think you want the Health Minister
Can I
next.
quickly ask, will you seek the direct London to Perth route back?
Oh yeah, we'll work with Qantas on all those things. And obviously, as I've said before, we'll put a big effort into tourism, international students, conferences, conventions, all those sorts of things. And the good thing about Western Australia, as compared with other states, is our financial management means we have greater capacity than them to invest in those sorts of things. So making sure those industries that have suffered over the course of the last 2 years receive some support is a very important part of what we'll do going forward. Amber?
Thanks, Premier.
Yeah, just the nurses, has there been any planning for that, or are you concerned?
Well, obviously we need our nursing workforce more than ever. I think it was loosely referred to by Mark Olsen earlier today. I read the transcript. They've got a number of concerns, the ANF, and they're representing their members with those concerns. I speak regularly with Mark and the ANF, and we've worked quite diligently to work through a number of those concerns. I think you can't really compare the situation in Western Australia with New South Wales. That's just not a reasonable comparison. Notwithstanding the fact that we expect lower peak case numbers. When we saw the cases peaking late last year, or certainly increasing, late last year, at the same time the New South Wales government lifted all restrictions. And they did that, I think, with little regard for the healthcare workforce. And 2 or 3 weeks later, we saw the hospital crunch, and we saw them under-crunched. So I think that we are absolutely not taking that approach. We're putting in place low-level restrictions from Monday to support our healthcare workforce, and our very high vaccination rates will also support our healthcare workforce. We value them, we need them. When I walk around hospitals at the moment, they tell me that they are ready. They know that it's going to be tough, but that they're ready to support the community.
Just on that, will you release the full Omicron modelling that you have? You will?
Yeah, early next week.
Okay. And the number of hospitalisations at the peak, you said we have 300 additional beds currently.
Yep.
So will it be enough at the peak, 430?
Yes, it will, because we'll also be using the private system. So we'll have access to the private system's beds as well as staff, and we are confident that our hospital system will cope. It will be tough. It's going to be a hard time. I'm not going to dress it up. This is going to be really challenging for our community because we have not seen high levels of COVID cases, but we do have the beds, and we'll be using both the private and the public sector to support them.
All this week, and even up until yesterday in the upper house, it was mentioned that the Omicron modelling would be released when it's ready.
Mm-hmm.
Was it ready this morning?
It'll be ready early next week.
So it's not
We
ready
have
yet.
data, and that's what we've shared with you today because we wanted to give.
Sorry.
We wanted to give people.
The what?
We wanted to give people as much notice as possible about the border reopening and the low-level restrictions that will go into place. So the data is available, and that's what we've shared. The package modelling will be released early next week.
I think the Commissioner has
Yeah.
answered the question. Yep. The Commissioner.
Questions about the Attorney General receiving an infringement. I'll advise that I initiated an investigation early this morning when the information I saw in the West Australian. I gave it to one of my acting deputy commissioners. It was tasked to one of our Perth-based officers. The infringement was issued late this morning and was paid about 1:30 p.m. this afternoon by Mr. Quigley.
What do you make of it, given obviously officers went into a church concerned about what was happening in that environment, and now the Attorney General's himself, the highest law officer in the land, seems to have done the same?
Well, the law applies to everyone, including the first law officer in the state, and he's paid a penalty of $1,000.
Is that why you took it so seriously and tasked it to such a senior officer today to deal with?
Oh yes, it's quite normal if there's a high-profile matter to be investigated. I always allocate it to a senior officer.
You're breathing a sigh of relief with the bottle shop removal from the proof of vax?
Look, I was with the Premier and the Minister for Police. We spoke to the association that represent that industry. Look, they raised their concerns. We have charged at least 4 people with assaults and the stealing of a phone. There have been quite a number of other reports provided. Look, in taking advice from the Chief Health Officer, the transactions at a bottle shop or a drive-through are often in the order of minutes. This is not a case where now, on the Chief Health Officer's advice, it's a situation now we've got our vax rate up very, very high. I mean, 99.5% of the West Australian population have received the first vax. It's unprecedented, I think, in the world, from what I've been scanning. So we are now at a situation where, based on the Chief Health Officer's advice, we're well prepared to relax that particular matter, but people will still have to register through Safe WA or Service WA.
Obviously you have to have a lot of resources on Operation Tide. How long for, in terms of officers literally sitting at a computer screen picking off G2Gs, given the level of training they've had and what their expertise is?
Well, they're not all sitting behind doing that. They're very active out patrolling. We have obviously had to police a number of disruptive events and respond to complaints, investigate breaches. So it is quite an extensive level of resourcing that we've had to do. But once again, we're in a state of emergency. It's again a situation where we cannot relax our policing efforts, because they've been very fundamental in protecting the West Australian community, particularly with our border controls. So we'll keep that while there's a state of emergency going.
Can you quantify how much, in terms of police resourcing, that you've had to throw at policing the proof of that stuff?
Oh look, it's hard to actually answer that, with precision, because we've got about 400 officers full time on our Operation Tide, but every police officer in the state has been conducting work to assist, whether it be at Euclid, Kununurra, at our ports up and down. I think over the last 2 years, people can quickly forget that there's ore carriers, cargo ships. We had the cruise liners early on. Extensive work's been done, not just at airports and road borders, but right through the whole community. So, look, I'm very proud. I think the community should be very thankful of what work the police have done to assist, particularly the Department of Health and all the medical staff that have been assisting.
Just on this unfortunate incident with the police dog attacking a 3-year-old boy at the beach, at the end of the story it talks about how the father got no update on how the matter was being dealt with until he had to submit a request through the police website. I mean, is that satisfactory?
That's not the information I received. The information I received was that the family were spoken to immediately, and we offered compensation to pay for medical costs, offered an immediate apology, and the matter was, as I understood, handled immediately with the family. I am advised the father has subsequently come and made some further requests from police, so we're working our way through with them. But certainly, look, it's regrettable. The trainer was there and did as much as he could, but you are dealing with a highly trained animal, but after all, it is an animal.
Dr. Robertson.
What evidence is there that by delaying from February 5 to March 3, hundreds of lives were saved?
So when we did the initial modelling, it gave us an idea of exactly what kind of numbers we would get. one of the factors that was critical in that was getting our booster doses up. What we know is that the 2 doses, whilst giving some reasonable protection against hospitalisation, does wane quickly over time. It gets down to around 80%, and that if we could get people up to 3 doses, that would kick us up to around 96%. That was going to give us that added benefit before we went into the major outbreak. We can calculate from there what the numbers are, and obviously some of that will have to be done in retrospect, because we actually believe that we now, because we are in such a good situation, that we will end up suppressing the height of this outbreak. We will reduce the numbers, we will reduce the ICU beds, and we will reduce the deaths. But that will, obviously, we will have to look at that. We've given some figures today, but we believe that they're actually probably conservative, and that we will probably our numbers will be lower than that.
And so you expecting, to put it crudely, like a short, sharp peak? So you're looking at kind of 5-6 weeks from now, peaking at the end of March, and then how quickly is it going to drop off, or is it going to extend into winter?
Look, it will have, you know, all outbreaks have a tail, so it will drop down over a number of weeks after that. It will, you know, we've seen that play out, I think, in a number of the other jurisdictions. We're looking at it dropping down probably to, by the time we get to sort of early May, you know, we'll be getting, our numbers will be down, you know, quite low. But as was indicated, you know, we need to look at keeping what impact the public health and social measures have had at that stage, and if we lift them too early, we will get resurgence at that stage.
So when you gave your advice ahead of January 20, what was the preliminary modelling telling you was going to be the peak number of hospitalisations and deaths as opposed to March 3?
So the modelling done at that stage looked at the two, you know, hypothetical situations. It looked at what happens if we opened on a particular date, and what happens if we opened on another date. So this modelling is actually factored on a real outbreak. It is actually modelling what this outbreak is looking at. This outbreak had obviously been growing slowly from early January, so this gives us a far better idea of what the real situation is rather than hypothetical situations. So, you know, we need to consider that in going forward. So the modelling will be issued next week, and that'll make it a bit clearer, I think.
So just on bottle shops, what's changed? What was your health advice around bottle shops initially?
So the advice around bottle shops was obviously, as part of the whole proof of vaccination, was we were encouraging people to get vaccinated, and these were measures to encourage people to really consider getting vaccinated. And it was actually very effective. Along with mandates in workplaces, this actually encouraged people to actually think about, you know, what is important here and should I get vaccinated. Now, given our very high rates now, the impetus of that measure have dropped, and unfortunately we have seen a number of, you know, both verbal and physical assaults, and obviously we are concerned about staff in those settings. They've done an amazing job, but we believe that now is the time to remove those bottle shop mandates.
Given the mandates have helped get the vaccination rate to world-leading figures, does that mean that now world-leading rates, it's now done its job, and you can actually start winding back that mandate in all sorts of different settings over the next few weeks?
So there are two sets of mandates.
Is it just time to get rid of vaccine mandates? Like what's the point of them at 98.5% vaccinated?
Because around 55% have boosters, and the large part of the mandate is to continue to make sure that we get people boosted. We know that if we can get them up, we're hoping to be, we're planning from our current planning and plotting of where we will be at. We'll be at around 70% at the beginning of March, but getting up to 90%, 95% will give us further protection and will help the community to weather this coming outbreak.
I
I think in your
So then you can get rid of the mandates when you get to 90% booster then. That's the point, they become redundant.
Look, I think that's a consideration at the time. We'll have to look at all of the, what the benefits are of all of our measures as we go forward. And we do that all the time. We're constantly reviewing our measures to make sure that they are achieving what we're aiming to do.
Are you looking, in your own mind, are you looking at fourth shots? Has that crossed your mind at the moment when you're considering?
So talking about a fourth booster shot, at this stage there's been no recommendations from ATAGI or from the Commonwealth Government nationally that we need to go to a fourth shot. We're actually getting good protection from three shots, and that's likely to carry on for some months. But obviously, if we get new variants or there are new threats that arise, that may be a consideration.
And natural immunity when the virus does start spreading, what kind of role does that play?
So natural immunity, yes, we will get a number of, a lot of people will unfortunately get infected, and that will obviously also provide some stimulation of their immune system.
Just very briefly, I've heard, correct me if I'm wrong, but I've heard in the UK that they've dropped the vaccine mandates for health workers. Will that ever happen in Europe?
So we're not proposing to drop mandates for any group at this stage. The vaccine mandates have been highly effective, but as I indicated, it is important that we get everybody boosted, and we've still got some way to go. And while we're getting there probably faster than almost any other jurisdiction, we still do need to get everybody boosted.
This data that you've been mentioning today that's going to feed into next week's modelling package, when was that first requested, and when have you first seen that data? Or the figures that have been shared today?
So we've been working, and this is the Department of Health's own modelling data, so we've been working on this for a number of weeks. So and it's being refined over that time as we've looked at the different options. So as you'll see when you have a look at the data and the actual modelling, it considers a number of factors, including the impacts of public health and social measures, when they should be introduced, those kind of issues. It also considers our booster vaccination rate. It considers the waning of previous vaccinations. So all of those are factors that are put into quite a sophisticated model, and we've looked at different levels and different time frames when we might actually introduce them and the impact of those. And we continue to do that because there are many variations of that as the situation unfolds.
And you mentioned before that the level 2 public health measures are factored into this data. Like what scenarios are they factored in? When is it just a range of time periods or case numbers?
So we're looking at different periods, different case numbers, and what impact that would have. I mean, the end of the day, what we're trying to do with these, with the modelling, is to identify at what stage, if we put in various measures, what impact that will have on the ultimate number of hospital cases, on the ultimate number of ICU cases, and at what stage we can do that with the best effect.
And so the
Last question, please.
Death figures and the hospital figures that you mentioned before, have they included those level 2 public health measures?
Yes, they have.
And at what point did they kick in?
That's depending on different levels. I gave a range. It depends on different levels that they've kicked in. Right. But you'll see that in the modelling.
Thank you.